What is pain management?
The question you've asked me is about having pain and being on treatment such as methadone or buprenorphine. The sad thing about drug dependence is that some people have actually started their dependence because they had some sort of pain in the early stages and used alcohol or opiates of some kind to deal with it. So pain and dependence are often quite closely mixed up. It is a problem, I think, that when you have a long-term drug problem and you're in treatment and you get pain, that people are suspicious that you're looking for increased doses of morphine or whatever it might be. And that requires a bit of care from you. I think you have to be quite upfront with your nurses or the doctors that look after you and pointing out that your pain is real. You understand their problem, that they're concerned about the fact that you're wanting to increase your dose of morphine. But I think if you're honest and open with them, they will be honest and open with you.
We know that people who are in a methadone maintenance program are very tolerant to opioids. They may require higher than normal doses of opioids compared to people who are opioid naive. Moving on to buprenorphine in terms of medication can cause particular problems with analgesia because it is a partial agonist. If you do find yourself in a position where you're attending an emergency department or another healthcare practitioner and you're concerned about the pain relief that you might have, then the majority of sort of what are called teaching hospitals, so the majority of large hospitals will have access to drug health services and pain clinicians, and it is reasonable to ask that those people be consulted, and particularly if you're on buprenorphine, it's really important that you get expert advice on how to manage pain in that situation because it's a very complicated drug to analgese well with. If you're not in a tertiary hospital, and particularly if you're in rural or remote Australia, all practitioners do have access to 24-hour help and advice lines, or they can contact a teaching hospital to which they're affiliated and ask for advice through their specific services.